So we have a couple of different things that we're going to do this evening. We're really, really thankful to have with us from the Global Engagement team, Aisha Usmani, who's here to help give us, start us off with sort of a health and safety overview for going abroad and some things to know because you're going abroad on sort of U of M business, because you're doing this as part of your MSW programs and your learning opportunities. So we're really thankful to have her here with us this evening. We also have in the back Katie Lopez, who you all know, director of the OGA, and then Sadia Bichara, who is also with us at the OGA and completed a GIS last year. So if you are going on a GIS experience this summer and want to hear from someone who's already done it, she is an awesome resource. So like I said, we have a lot planned for this evening. I think we'll just go around really quickly to do introductions. If you could just say your name and where you're traveling this spring, summer, that would be perfect. And we'll just leave it at that for now, and then we'll jump into Aisha's presentation. After that, we'll have just some little sort of like logistics, things to think about. We're going to talk about ethical photography, thinking about identity going abroad, resilience in traveling, and then we're going to leave a good amount of time for question and answers. So you can feel free to sort of, have questions as we go along, but know that we will have time both at the end of Aisha's presentation and at the end of our presentation as a whole. Okay. So if you wouldn't mind, we can just sort of like go around the room really quickly. Again, just say your name and where you're traveling, and that would be perfect. So Sydney, why don't we start with you?
Okay. Hi everyone, my name's Sydney, and I'm going to Austria and Germany.
Hi everyone, Priscilla, and I'm going to Hong Kong.
Hi everybody, my name's Abigail, and I'm going to Australia.
Hi, I'm Clancy, and I'm going to Zambia.
Hi, I'm Renee, and I'm going to go to Jordan.
Hi, I'm Lady, and I'm going to London.
My name is Annie, and I'm going to Chile.
Hi, my name is Aki, and I'm going to go to Japan.
Hi everyone, my name is Andres. I already came to Colombia. This is my home country, so I just came basically to, if you have questions or something like that, maybe I can help as well.
Thanks. Okay, and David, perfect timing.
Oh, yeah.
Do you want to just introduce yourself, your name, and where you're going this summer?
Oh yeah, hi, I'm David Hay. Pronouns are he, him. I'm going to Melbourne, Australia this summer.
Perfect. Thanks so much, everyone. Okay, without further ado.
My name is Aisha. I work in the Global Engagement team as the International Travel Safety Manager. Of course, my goal here is to make sure that you have a safe and healthy experience abroad so that you can focus on the important work that you are doing. Just to give an overview of what we are covering, we're going to cover U of M travel requirements and resources, just because, like Greta mentioned, you are going on for U of M related travel. We want to understand risks abroad and understand well-being. What is well-being like abroad? Of course, we can't go over every single situation or risk that you might face while you are abroad, but we want to make sure that you develop a toolkit to approach each different situation so that you have an idea of what to expect in these situations. And so with that, we're going to also incorporate some scenarios so that you're going to team up with each other and discuss a few scenarios. So just a reminder, here are your U of M travel requirements. The first step you've already, I think, technically completed, which is register your travel. If you have an application in mCompass, you've already registered. In terms of risk ratings, so each U of M, each country has a designated U of M travel risk rating. And so if it's more elevated, then you do have to complete certain requirements. I think I heard Jordan, I think most likely, or no, maybe Jordan not, because only certain areas do. But I'm trying to remember which country. But most of you are going to travel health low-risk destinations, which means there are no additional requirements to complete. So less steps for you, but always double check and just make sure if you do need to complete a travel health plan or a safety plan for your destination. Enrolling in travel abroad health insurance, we're going to explain how that works a little bit more in detail, but you do have to enroll for the duration of your travel. And then complete any your college requirements that you have to complete. And if at any point you have questions in the middle, then feel free to pause me. So just a little bit about travel registration. What's the purpose of our travel registration? So all of you are in our system, but the main thing is we just want to make sure that we can reach out to you if there was an emergency. For example, if there was like protests or flooding or something that was happening in your destination and we see it on the news or we get an alert, we might send you an email and be like, hi, so-and-so, are you doing okay? We noticed this was in the news. How are you doing? So if you get an email like that, just make sure to respond to say everything's fine. Most people are like, okay, I'm not affected, or some people might be affected, and then we can sort of guide you on what next steps and what support we could provide potentially. If you're traveling on like personal travel, so right now your registry is including your program dates or your trip dates. But if you are traveling beyond that, either before or after, or if you're going somewhere else, like let's say, for example, you're going to Germany and Austria, and you decide to take a trip to France just for the weekend, register that travel as well as separate. So if something did happen in France, for example, there's so many protests happening right now, we can contact you if there was a more elevated situation. So this is what you have access to once you register your travel. Alert Traveler is an opt-in feature, so you can download the app, but you can get real-time alerts. Once your travel dates begin, you'll start to get notifications about that destination of anything that's happening. You can also go and check, health and safety information on that destination as well. Another thing that you have access to is step registration. So technically it's only for US citizens, but if you are an international student, you can still register for it. You just have to put 000 for your passport, so you can still get the notifications. But this is just another way the US Embassy in your host destination, host city, will send you alerts if anything is happening, of course. So these are just ways that you can get information about what's happening in your destination. They usually give X is occurring. These are the suggested practices that you need to take. So they'll usually give advice as well, in addition to what is occurring. So travel health preparation. So there's many things that you, of course, can do in terms of your travel health. As U of M students, you have access to UHS, the U of M Travel Health Clinic. And so you can schedule an appointment with their travel health clinic. They give destination-specific advice. So if your destination needs, for example, vaccination, or if you need certain medication before you go abroad, like anti-malarial medication, you can go to the travel health clinic. They'll walk you through that process, get you that immunization that you need for that destination so that you don't have to go to a separate doctor's office. So go ahead and, if you do need that, go ahead and schedule that in advance so that you have enough time to have that appointment. Or you can, see your healthcare provider individually as well. So planning ahead in terms of managing well-being, of course, this can cover so many different aspects. But here are just a couple of tools that you could implement before you go abroad. In your mCompass application, you should see a travel health preparation guide, and that asks just a list of questions of what you should think about in preparation for your experience of how is it going to be different while you are abroad, because some things you might not think about. You're like, okay, I do this on campus, but you might not be able to replicate it right away in your abroad destination. And so these are just a list of questions that will prompt you. You can go through it with your physician or therapist or a family member or friend, just so that you're at least thinking about these questions before you go abroad. Another useful tip is to learning appropriate medical and mental health vocabulary. Some terminology doesn't always carry through. What terms that you use here in the US might not carry through while you are abroad. And so just learning if you have certain pre-existing conditions or certain needs that need to be met, look into the host culture to see what would be basically a similar term in that destination. And so sometimes mental health is not viewed the same way as it is in the US. I mean, it's still taking a long time to becoming more accepted in terms of mental illnesses. So making sure when you are in that destination, see what terms are appropriate, what terms are needed to convey what you're actually feeling. Another thing, of course, if you are on medication, make sure you have access to that medication while you are abroad. We're going to go over insurance in a little bit, and you'll have those resources to get medication filled abroad. But if you have certain medications, some medications might not be legal in that destination. I know you mentioned Japan. I know Japan restricts a lot of medication that is typically prescribed in the US, but might not be prescribed while you are abroad or allowed to even bring it while you are abroad. So if you are on certain medications, then make sure that they are, one, legal in that country, and that if you need to, have a 90-day supply, sometimes some doctors don't want to give even a 90-day supply. So seeing if you are able to get that filled while you are abroad, or if you can have enough supply while you are there.
Do you have a recommendation for a resource where we could look into like what is allowed in other countries?
Yeah, so I'll share a link with Greta, and she'll pass it along to you. There's like the International Narcotics Board, and they, of course, it's not going to have every single medication, but it's probably the best resource to determine if a medication is legal in that destination, and it will give like some locations it might be illegal to sell it or purchase it there, but you could potentially bring it if you have a doctor's note. And so rules vary depending on the destination. So some it's like an outlaw outright, like you can't bring it at all. And some destinations you could bring it just because if you can prove that's for only your personal use.
And I would just add that it's not just, I think sometimes we think about narcotics, but it can be things like, I think at one point, I don't know if it's still true, but some ADHD medication wasn't allowed in Japan, right? So just even if you're taking anything, I'd highly recommend you just look into it, because you don't want to run into the situation where you're having to take something you don't normally take because what you take isn't available.
There's even some things that are over the counter here. So in Guatemala, you cannot bring pseudoephedrine, which is just Sudafed, right into the country. So yeah, it covers a real wide range.
Yeah. So yeah, some medication you don't automatically assume that it's illegal. So definitely look into those specific medications. And then being aware of travel escapism. I know there's a section on resilient traveling, so I'm not going to go as in depth into that. But oftentimes when students go abroad, they might assume that any problems that they have here on campus or in Michigan may disappear if they're just in a different location. And so sometimes the problems that you have here could carry over. Sometimes you just might have a different experience. Sometimes you might have new problems when you are abroad. Just being aware of that concept of, yes, we want you to have a good experience. Yes, you're going to hopefully have a exciting experience, but just making sure that you are taking care of yourself first, and making sure it's completely normal to be overwhelmed when you're in a new environment, and sort of seeking those resilient travel resources. All right, so we're gonna do a scenario. So I'll read it off, and if you could just maybe work with the person next to you and discuss what your next steps would be in this situation. And all the names in these scenarios are my colleagues' names, so it might be a repeat if someone is in here, but there's no intentional singling out of anyone in the audience. It's just my coworkers. All right, so the scenario is, during the program, Wyatt is very quiet, has difficulty waking up, and does not seem to be adjusting well with his program and the new environment. He shares comments recently that seem negative and possibly depressing. What could Wyatt do in this situation? So I'll give you a couple minutes just to talk it out with the person next to you, and then we'll bring it back.
And see what recommendations. Yeah. I did receive your. I do have a lot.
Traffic is a real thing. Don't worry. If you want to call their choice, you can have discussion. Please feel free. You're not interrupting. We're really glad you're here.
Sorry, we're just trying to get something behind the scenes.
I think it's also like, I mean, he ideally would have done this before traveling, like, he can't do this job.
But still,
Yeah, that's what I.
you have this awareness. Some people have it in the morning, the rest of them don't. So I'm Wyatt. It's kind of interesting the way the question is phrased. It's different when I'm talking to Wyatt. I am Wyatt. I would have to ask myself.
Sorry.
All right, let's bring it back to the group. Does anyone want to just share what their group talked about? What could Wyatt do in this situation? And there's no right answers. It's just complete, just sort of discussing it together.
Yes. So the way the question is phrased, like what could Wyatt do? Like so it's not me like engaging Wyatt. Like I'm Wyatt, I would have to feel. I would know myself where if this is going to be a temporary situation, like how long. It could be 15 minutes, and I'm fine, right? So I need to see if it's like long term, because then obviously some more intervention is needed. Because I could wake up in the morning, feel this way, and then the rest of the day is fine, right? So I just sort of would have to like, if I'm Wyatt, I have to know myself like, this is going to last the whole day, right? So.
Yeah, so sort of assessing like,
Right.
is this a temporary thing or is this actually could develop into something more serious?
So I was also confused about, am I Wyatt or am I like Wyatt's companion and suggesting something to Wyatt?
I think it doesn't matter, whatever way you want to approach it. Of like, if you were Wyatt's like classmate and you're just like noticing this, or I phrased it in a way so that it could be you as well in that situation.
And Wyatt is somewhere else out of the country.
Yeah, so they're not in the U.S. They're on a program abroad.
So, yeah, I think we kind of talked about the fact that if it's something that does need some help, then maybe contacting the university and UHS through the the office here to see if there may be any resources available. But then again, I don't know what the issues are with treatment, even if it's telehealth, if the person is not out of state. So there are those regulations.
Yeah, and we'll go over to telehealth resources,
Right,
but yeah,
right. So-
seeking help from, university contacts or potentially medical professionals. Anyone else want to share? Yes.
So maybe contacting a family member or friends, that way someone at home is alert to the situation, and contacting them make them feel better, but otherwise, they have like a little red flag, so we can reach out, follow up with them, and maybe help with getting the resources.
Yeah, so could be Wyatt might feeling a little bit of homesickness potentially. Maybe it's like they just need to see a familiar face and just talk to someone. So different things that they could potentially do. So here are just potential suggestions. So if there's someone on site, the student could potentially connect with an on-site person. I know most of you are doing more independent type experiences, so there might not necessarily be a direct person, but if you are working with a supervisor or a colleague, that could be a potential, just maybe you want to talk to someone. If professional help is needed, like you mentioned, there are ways that they can get help. We're going to go over a little bit in the insurance piece by using GeoBlue. So there's telehealth services as well as going physically to a therapist or a psychiatrist if needed. If there's peers, so if you happen to be with other students, I know this group is a little bit more unique. If you notice Wyatt in that situation, maybe it's like, hey, how's it going? It's just maybe they just need to talk to someone. And you don't have to be a professional, you don't have to be an expert, but just checking in of like, hey, how's it going, type of thing. And since you are on independent experiences, I know some of the groups brought up of like, are you Wyatt or someone else Wyatt? How are you going to approach the situation? In most cases, you're going to be on these programs independently. And so, yes, I framed it from a lens of Wyatt and not you, but in most cases, you're going to have to self-advocate for yourself because we are not going to know, or your office is not going to know of what situation you're in. They might just send, regular check-in emails, but until you reach out, you seek for help, they're not going to know, and we're not going to know what support we could potentially provide. And so it's a tricky balance of like, yes, hopefully people around you can support you as well, but if you are in a space where you're not working directly with others, you're kind of doing your own thing, you have to be sort of that self-advocate, and ideally you'll have the resources available to you, and you can sort of check in with those resources. Anything else anyone wants to add? Next, I mentioned this insurance piece. It's definitely an important piece. It's not the most exciting piece, but it's the one that we get the most questions about. So GA Blue Travel Abroad Health Insurance, all of you will be enrolling into that for the duration of your travel. You can also cover it for your any personal travel as well. So even if you are, like let's say you're doing a personal trip, it will cover any location outside the US. So even if you are, let's say you're taking a flight and you have a layover in a country that's not your final destination, the insurance will still kick in. And so it's probably really good coverage, probably better than my own insurance right now in terms of the coverage that it provides. So 100% of reasonable coverage, no deductibles, no copays. You're just paying for that initial cost of that insurance. So it covers, doctor visits, hospital visits, including telehealth appointments. If you need to get any medication that's prescribed overseas, it will cover that. If for emergency evacuation, that includes medical, political, or natural disasters. So if there was like a natural disaster in that area, then we would work with our insurance provider to see if you need to be evacuated. Mental health services. So the cost is about $1.57 per day per person, and then there's a $5 administrative fee on top of that. So in terms of once you are enrolled, so once you purchase the insurance for your trip, these are a couple of steps that you can do before departure. One is register your account. So you're enrolled, you're covered, but registering your account gives you access to the online services. And so we always recommend just doing it before you go abroad, so that if you are in a serious situation while you are abroad, you're not worrying about these steps while you are there. Another thing is you can download the app, so if you know you're going to be in an area that has good data or Wi-Fi coverage, then you can go ahead and download the app. You can still use the online website if you want to access these services. And on the member portal, you can see, where's the nearest hospital or clinic that's in your area. You can see, medical equivalents. I know we had the questions about medication earlier. And so there is a possibility that you can use that medical equivalency to see if a medication is available, and it's usually a good indication if that's legal. So if it's available in that country, or if there's an equivalent of that that's available, that's one way to identify if it's legal there as well. So definitely check that out before you go abroad, have that app downloaded before you leave. In terms of using GeoBlue while you are abroad, you would first identify the hospital or doctor's office that you need to go to, what medical provider, using the GeoBlue website or app. Then, of course, depending on the seriousness of the situation, you can either go to the nearest one, or you can schedule an appointment. If it's not as serious, you can schedule an appointment using the contact info provided. Prior to the visit, again, if you have time to do so in your situation, you can work with GeoBlue to arrange direct payment so that you aren't paying out of pocket. If you weren't able to do that before you got there, or if it was an out-of-network provider, which we'll explain in a little bit, you can pay out of pocket initially, and then you'll file a claim for reimbursement. So there is a way that you will get that money back. Of course, in the event of a medical emergency, don't worry about if it's a GeoBlue in-network or out-of-network. Just go to the nearest hospital or physician immediately, and then you can work on the back end, or loop in OGA or our team to work with GeoBlue if it's a serious situation. So this is sort of explaining a little bit about the in-network and how does that work. So in-network is anyone that the GeoBlue app lists of like, okay, this is a hospital you can go to, this is a pharmacy that you can go to. They have an agreement regarding payment with them. And so you should not have to pay out of pocket if you go to any of those providers. Non-participating or out-of-network providers is any doctor, of course, in the U.S., but you will be paying out of pocket. So in those situations, make sure that you keep a copy of the receipt so that you can file a reimbursement on their website. And the receipt can be in any language. It does not have to be in English. It can be handwritten as well. As long as it lists like what services were rendered and what was the cost, you can use that to file the claim. And those are the instructions for filing the claim on the website. In terms of telehealth services, there are two services that GeoBlue provides. So one is TeleMD. So those are virtual appointments, and they give sort of general medical guidance for any non-medical emergencies. And so you might be directed to in-person care if it was a little bit more serious. So it's available 24/7. They have multiple languages available, and you can download the global TeleMD app. So this usually for situations that aren't as serious. Maybe you don't want to go all the way to the doctor's office or to the hospital, and you just want to speak to a medical professional just to see, based on your symptoms, what could this be. Global Wellness Assist. So you have access to a virtual mental health counselor. So if you're feeling, stress, anxiety, depression, you can access a mental health counselor as well. And so that is virtual. You can access that through the GeoBlue app as well. And so those are potential resources from our previous scenario that Wyatt could use if he was not feeling well in that moment. Yes.
I have a question. I know that in the past, if students knew that they were going to need some, it would be helpful to connect with a counselor or with some type of healthcare provider, whether it was medical, whether it was mental health or physical health, that students could work with GeoBlue ahead of time to identify and get set up with a provider in country. Is that still a service?
That is still, thanks for reminding me about that. So if you have certain needs if you have, for example, a pre-existing condition that you want to get continued care while you are abroad, you can go ahead and schedule those appointments. So if you're going to be there between May and July, and you want to make sure you have an appointment in June and just have that set beforehand, you can go through the GeoBlue app after you are enrolled in the insurance and go ahead and schedule an appointment so that you don't have to worry about while you are abroad. So you can go ahead and do that. GeoBlue also has a new service actually out that we recently found about. I'll share the flyers with you so that you can pass it along with the group. So they have pre-departure services available even if you are not enrolled yet in the insurance. And so what this is, if you have a certain health need or a medical need that you want to make sure that you can get treated while you are abroad, for example, if you had diabetes and you want to make sure that you can get regular testing supplies, see a doctor in person if you need to, you can talk to them and just make sure in X country that I'm going to, will I be able to get these services provided? And they have a nurse, a medical team that will be working with you, and they can discuss those questions with you. So it's a new service that they have. We'll be sort of publicizing it a bit more to everyone, and we'll share the flyer with you, but you don't have to even be enrolled yet in their insurance. So if you want to just have questions, you want to make sure, for example, if you're going to Jordan, are you going to have access to these services, specific services, before you get there? You can, talk to their medical team and make sure that those services would be available to you.
So you said we could potentially schedule appointments if we know that something.
Yeah, so you can go ahead and for the scheduling appointments, you'll have to be enrolled first, and then you can go through the app or the website, find the doctor or service provider that you need, and then they'll have a contact info on there, and then you can go ahead and schedule that appointment.
Like ahead of time?
Yes.
But it has to be providers who are on their
yes,
network,
so
not with our current.
It would be with providers that within their network.
Yeah, we've worked with students that have done it both ways before. I remember one year we had a student that had a pretty severe, I think, bipolar, right? And so it was well managed, but knowing that it might not be well managed while they were abroad, they wanted to have appointments set up ahead of time. And so we were able to help them. GeoBlue was able to help find a person, connect them, and they had an appointment set up before they ever went in country. I've worked with other students that had either pre-existing physical health issues, someone that had experienced depression before when they were abroad, and they just identified someone they could reach out to if they needed to. So I think what we don't want to do is just be reactionary only. If you've had something that's happened before, you anticipate something might happen, you can actually set yourself up in advance instead of scrambling when you have a lot of other things going on. So I think it's one of the outstanding things about this is it's not just a reactionary insurance policy. You can actually be proactive. So
If we go to out-of-network medical facilities, what is the coverage?
So the coverage, I'll share a link with like the full coverage benefits where it lists any exclusions. But in most cases, it should cover 100% of reasonable coverage, even if you are out of network. The only difference is that you'll be paying out of pocket initially. So if there was a cost that you have to pay upfront, once your services were rendered, you would have to pay that, and then file a claim for reimbursement on the GeoBlue website, and then they'll refund you for that cost. So that's the main difference. But if you want to make sure, usually if you want to make sure that's guaranteed payment and you don't have to pay out of pocket, you can go in-network. But in some locations are more remote and they might not have an in-network provider. In this case, you can still go to an out-of-network provider, but just keep that documentation so that you can file that reimbursement.
we've had students that have had broken legs while they were abroad, right, and had to deal with that.
None of you.
Yeah. We actually had a student that unfortunately had cancer come back and had to undergo surgery, right, and they didn't pay for any of that service. It was all coordinated. And so I think sometimes students grumble and say, like, oh, I have to pay for this extra insurance. I already have insurance. It's been really helpful for some of our students. So.
The only thing that it doesn't typically cover is anything preventative. So if you want to get like a physical while you are abroad, or get dental work, that usually like regular cleaning, that's not going to be covered. But if someone punches you and you lose a tooth, then that's covered. Okay. So post-departure trip interruption insurance. So PDTI, the hardest acronym always for me to say. So this is a recently added benefit as of last year, and it provides specific benefits to students on U of M related travel for if their trip is interrupted or discontinued due to covered reasons such as a covered illness and travel restrictions. So in insurance terms, that basically means that, for example, if you get sick while abroad, for example with COVID-19, and you have to delay your trip because there's a government mandate, for example, to self-isolate, and you are scheduled to return, for example, like in 2 days, like your flight was supposed to leave in 2 days, then they provide coverage for housing, incidentals, so any food expenses, and then transportation. And so this is really good coverage, but there is very specific criteria that has to be met in terms of for the insurance to get kicked in. And so the first thing is just determining that eligibility. So if you did have to delay your departure or self-isolate, there has to be either a government mandate, so the government, on their government website, it says you must self-isolate for 5 days if you test positive, and it's not limited to COVID-19, it's also any other infectious disease. So if a government is mandating it, or if a doctor is mandating that you need to self-isolate, then the coverage kicks in. And so depending on your living situations, if you're living by yourself, then you don't have to worry about this piece. But if you did have a roommate, the coverage only applies to the person that was actually infectious, not the roommate. I know some situations the roommate might be like, hey, I know you're sick, I'll let you stay in the room, I'll just go somewhere else. Because of the way that this insurance works, it only provides coverage to the person that was ill, and so the person who was ill would have to leave the space to get that coverage. So next you want to get tested, so you want to make sure you have documentation that you have a positive test result for that illness, so you can go to a medical facility, a pharmacy, or so forth. The key thing is just needs to be timestamped so they know what day that the coverage needs to kick in. And then securing housing and transportation. And so if you're in a space where you can self-isolate already, if you're in a single apartment, technically you can self-isolate in that space. But if you are in a shared situation, or if you're potentially it was near the end of your program and you were vacating that space, then you can seek alternative housing. And then if you need to change your flight, for example, you would change your flight yourself. The key thing about this is that you would initially pay out of pocket, and so you would file a claim for reimbursement. So any of the housing, like if you paid for a hotel or got room service or needed to change that flight, and you have like documentation of the flight fee change, then you would file that claim for reimbursement. And these are sort of the coverage limits of what is included in the benefit. So if you have questions, definitely feel free to reach out to us. I know this one's a little bit more complicated about when the insurance is like eligible to kick in. But if this did happen to you, then thankfully there is some financial support available for this situation. So we have another scenario. So if you want to talk to the person next to you. So you begin to experience cold-like symptoms. Your project work is in a remote location and the nearest pharmacy or clinic is about 1 hour away. You have limited cellular service and no access to Wi-Fi currently. What are your next steps? So you can speak to your neighbors for a few minutes and then we'll regroup.
You can't contact them. So in that area, so now I understand the logic now. So I would first talk to before it gets started. Because I was why can't that every day in school,
What is in this scenario if your responsibility is where we're going, it ain't for me.
And I think one time we're
exactly. Get some orange juice and
really fighting to get
if not, I'll just go
your
find a
phone.
way to
Yeah.
get there. I'm like, I got to that location. So I have to Uber, whatever. Hire a bicyclist, jump on a bike
Yeah, you're right. Like, especially if you said it, they have a whole nationwide and Patrick is probably they have it's actually mostly like calls.
Yeah, right. Get your essentials and
You know, when you're like, I cannot get
No, I don't
situations where a call from a student, right, to
the local mayors.
all of that. So we do sometimes respond to
So yeah, just kind of escalated to make every effort to communication.
we're not always to be the first responders. Nobody.
Walking.
Yeah.
Bike, scooter, Uber, horse, donkey. Whatever. You gotta escalate. So you find a regular transportation. So you have to do.
Or you're doing whatever.
It'd be worst case scenario. So I have to go down to worst case you walk, right? So maybe a bicycle, maybe a motorcycle, motorbike, find somebody who can and the horse is like last resort. Can I rent the horse?
Sleeping or whatever else. It's not also part of it.
Alright, we'll bring it back
You never know.
to the group. I heard some interesting horse conversations over there. But what did your group discuss? What if this happened to you? What would be sort of your next steps in this situation?
I spoke
I know that there's a phone number that you can call when you're outside of the US for GeoBlue, so if you could get some cell service, and call them, that would be my first step, if you could get enough to connect.
Okay, so potentially contacting GeoBlue. You have, right now you have limited cellular service, so maybe walking around and seeing if you need to contact GeoBlue and see if you need to seek, professional help. Yeah. Yes.
Yeah. Okay. Go.
We were talking about first seeing if there's a supervisor in the area that we're located, and if they could help us with any resources in there to get any contact or anything that could help us get better. And then start thinking from there what will be the next step.
Okay, yeah. So definitely using your on-site contacts. Perhaps, ideally you're not in a remote area just by yourself. You're with someone else. There's either local community people, either a supervisor or a colleague is with you, and say like, hey, this is happening to me. What should I do in terms of what's the nearest hospital I could go to, or should I go back to my housing and just, wait it out for now? Anything else anyone wants to add?
We were talking about how, if you wake up and you feel off, it's probably not a good idea to, leave the house or wherever you're staying, just so that you can be a bit proactive in trying to prevent the situation.
Yeah, so potentially they could have, woken up that morning, had, a sore throat, and they're probably like, oh, maybe it's just because it's just the morning, but maybe if, initially if they felt that, then ideally they wouldn't already be in that remote location. Anything else anyone?
We were just saying, we feel that way every day here since we've been in school, so is that even, it's the norm. But basically, we were just joking the way. The last resort is to walk that 1 hour, Right? I mean, you have to keep escalating till the last resort, right? So.
Yeah, so we don't know. We don't know how serious the situation is. I made it vague on purpose so that, it could be serious, it could not be serious. And so, potentially, just determine, next steps, did you look into some public health guidelines? Are there? First of all, we don't even know if you have an infectious disease. It could be just a temporary thing, and so you want to work with your on-site colleagues to see, do you need to get isolation space first? Do you need to test positive? What are their, how comfortable do they feel in terms of interacting with you? Potentially they could be like, wear a mask around us and we're fine, just keep a distance. But they could, be respectful of that local community. Maybe they don't have high vaccination rates in that area. And if you did have COVID, you don't want to be a burden to that community. And so it can really vary, and it can really range, what your severeness is, and it can range of, what it is actually, what is the actual illness. Potentially it's just a temporary thing. Potentially it could get more serious. And so this did happen to a group while they were abroad in a really remote location, and they did have COVID based on an at-home test that they took. And it was a very interesting situation because they wanted to get tested to go to a physical, they took the at-home test, but they wanted to go to an actual clinic to get an official test. But they didn't want to ride in the same vehicle as a local community member because they didn't want to expose them as well. And so I think eventually they decided to just wait it out. They weren't actually too far from their housing accommodation, so they were able just to wait it out rather than exposing the group and going to the next destination on their program. So it can really vary. So being mindful, maybe having those conversations beforehand with your supervisor, any on-site colleagues that you're working with, of what is the protocol in general. Even our office has a general protocol at U of M. If you're feeling unwell, stay home. That's the current protocol that we have. And so just talking to them, see what they do, what's the best practice. If it's just masking or in social distancing, that could be something that you can do. If it's, staying away from the space, there's many ways that you can take this. And so especially if you are going to be in remote locations, whether that's getting actual physical injury, injuring your leg, or having illness-like symptoms, take that into account when you are going to these more remote locations. What is the nearest hospital? How am I going to get access? Do I have access to cellular service? Or for students that are in more remote locations and they know that they're going to be there for a long period of time, sometimes they take satellite phones just to ensure that they have that availability. And so I don't know how remote your areas will be, but take that into account for any destination that you're going to. So these are just best practices. Of course, it's going to vary based on your destination. So this is more of a general best practice for whatever destination that you go to. Learn about your destination. You're probably already doing research into the community, the program or project that you're working on. So take a little time, learning about the local culture, learning about who you're interacting with. Also learn about the health and safety side of things for that destination that you're going to. Another thing is checking entry and exit requirements. So one, of course, making sure your passport is valid, check what visa requirements you have. I know there was discussions about visas earlier when people were walking in. And also make sure that you are meeting any public health requirements. In general, most countries have removed any COVID-related requirements. Very few countries have them in force, but still check, and if you need to, provide proof of vaccination or provide a COVID test, even if you don't have to provide proof of vaccination for COVID-19, it might still be good just to have a copy of your vaccination records, just in case you did need it. Next is, having a contingency plan and, taking into account any accommodations that you may need. So, of course, you can't plan for every scenario, but try to at least sort of think about it of like, if you did face travel disruptions, if your flight was delayed, or if you're moving between cities and, transportation gets shut down for some reason, because I was reading this morning, there's transportation between the UK and France is shut down because of the ongoing protests. So that could happen in your area. Any unexpected financial expenses, any project complications, sort of have that in the back of your mind of like, what would you do? What is your plan B, essentially, if something does have to change? And then if you have any like learning or any housing or dining accommodations that you typically have here on campus, see if you need to replicate those while you are abroad. You're not going to be necessarily in a classroom setting, but if you did have certain accommodations that you are used to having here, make sure you, again, advocate for yourself and see if you need to seek those services. SSD, the Student Services with Disabilities, they have a process if you are going abroad, and they can go through a list of questions with you and see if you did need to replicate any of those services abroad, see what's feasible and what's possible. And then finally, just prepare your logistics. These are just links that you can have resources for travel tips and packing. Taking into account the weather and the climate in your destination is important. In terms of on-site, transportation is probably the biggest factor of students potentially getting injured while they are abroad. And so make sure that you are checking, your transportation options are reliable and safe. Check the road conditions in your area. Does it make sense to take public transportation, or should you take, Ubers or taxis? Or if you are within walking distance to wherever you need to go, making sure that you are alert when crossing the road. For example, if you were in London, traffic drives on the other side than the US, so making sure that you're checking the other way. I was recently in London and I would always forget, so I would always just check both ways when I cross, just to cover all my bases. And then know how to get to whether that's your study or work site or housing through alternative routes. So if for some reason the normal route that you take wasn't available, just know a backup option as well. Communication, having working phones, so making sure either you have international roaming or international data plan on your phone. If you can purchase a local SIM card, if that makes sense, you can do that. I know some of you might be only using Wi-Fi if you have Wi-Fi available to you, but if you are traveling about and you're relying only on that Wi-Fi, take that into account as well. And then just general healthy habits, practice regular hand washing, take into account any food or water precautions. Some locations will be, very similar. You can drink the tap water. Some locations you can't drink the tap water. And then anytime you go to a new environment, you tend to get like an upset stomach regardless of the location and the food quality. So, pack, any like medication for that. For any environmental protections, if you're going to be in a very hot or you're going to be out in the sun, pack sunscreen, stay hydrated. If you're going to be in an area with, a lot of mosquitoes or bugs, pack that bug spray with you. Sometimes you'll see animals in the street, stray cats or dogs. It might be tempting to approach them, but I usually recommend not approaching them. We just had too many situations where students would get bitten, and so you don't want to be in that situation. And then these are just general personal safety precautions. If you have the ability to do so, don't go out alone at night, or at least inform someone if you are traveling. Let's say you're like, hey, I'm going down to a restaurant. I'll be back at 9 p.m. Also maintain situational awareness when you're walking about. Don't be like staring at your phone or have your headphones on. Just be aware of what's happening. As a good practice, if you notice like locals doing certain things or locals avoiding certain areas, that's a good indicator of like what's a norm in that area and what's safe in that area. Our last section is just general emergency protocols and then resources. So of course, if there was an emergency situation, you want to tend to your immediate health and safety needs. So if health needs, if you need to go to the hospital right away for safety, if you're in a dangerous area, just find a space that is safe, just move away from that area, and then call any emergency services that you need. Next, you want to work with any local contacts. So if you have any supervisors or colleagues that you're working with, they might not necessarily be like medical professionals or law enforcement, but they have an idea of how that country works, and they can give advice of how to navigate those services. And then finally, you can contact U of M. So I recommend everyone saving the U of M DPSS phone number in their phone, or try to memorize it if you can. You can call that number while you are abroad and let them know that you are a student studying abroad and you have a certain situation. That loops into their, the operator loops our team in and lets us know, and then we can discuss sort of next steps with you in that situation. And then for any non-emergency situations, that's our email address, but you can also contact your school social work reps as well. The resources, I'm not going to go too in-depth, but I just want to make sure that you have access to them. CAPS, so Counseling and Psychological Services, you all have the same resources that you have here on campus like abroad, but you can still access their telehealth services up to 6 appointments while you are abroad through ZooBill. They also have an after-hours counselor that you could still call if you were in an emergency situation. You can call that number. SAPEC as well has an emergency crisis line that they can support you with. It's confidential. They can support you in that resource as well. And then Student Life, you can still access these services that you have on campus while you are abroad. And if you don't know who to access, you can always work through us or work with your unit and see what services that they can move you into. And these are just links that you have for GeoBlue and the International Center in Global Michigan. So here is our final exercise. I have a couple of scenarios that I'll divide. I think you have about 3 to 4 people per group, I think. Oops. So each of you will have one scenario, and then we're going to discuss it as a group. So this group will have scenario 1. I'll let you join here. Scenario 1. And your group will be scenario 2.
I'm 2.
You prefer 2 or 3? No. And then your group will be 3. I'll give you a couple of minutes, like 5 minutes, and then you can pick it out.
No, you did not. I was just trying to not run over your field.
Yeah, that's what I would.
And it depends on the source you're in, right? Like, I would see where's the next train stop, you have to walk to that train stop, right? It depends on the distance, right? And it depends, like, if I have no ways to go, then watch the protest. Learn something about the culture, right? I mean, don't engage with it. You don't have to engage with it. You just kind of watch. It's like your person 8 times you relax. Right? It's true. If you're 8 times, then if you were 8 times, 10 minutes, you'd be like going like this, right?
Thankful for because I could spend
Kind of,
stay on that.
I would have so much stuff, but as you were taking it, and I did it. Yeah.
Just go grab a
Where's that you guys going? I'm going to Zambia.
To Zambia, I will be more concerned than that.
Is that really happening? Like, I don't think a run yourself would take a picture like I love it, but I still I'm sure they have something. You know,
What about you?
They were first time I went to and like I just understand why you framed it that way more and more. It's very different.
I know. But I know a lot. So could be.
Right perspective.
Right. I was going to say, in 5 minutes, and I'm just like,
No, I lose time too. So I leave on, okay, I leave on the 15th. So I started my insurance on the 15th. I'm like, I just started the 17th because I'm not even going to be here. San Francisco.
that's really good.
How long is the flight from San Francisco?
Wait, so like I can suggest.
The whole thing is about
You going to Melbourne?
it's a lot. I think those should
Yeah.
just
It's a no
snacks, be comfy and just.
Yes.
Yours too, Dave? How much stuff do you have?
I have 2 stones.
Responsibility for action galleries.
Where?
Right?
Well, I
Looks like a few specific people always. It's like,
Seattle is my first.
join our gossip circle, sorry.
Oh, so fast.
Yes, it was.
Well, in Qatar, maybe just
Is there like a
people
nearby?
around pass.
Yeah.
You can just nap there. Yeah, if you don't have
You being good at Tampa is really to your demise.
I don't know.
No, I don't think it's past.
Yeah.
food is
So,
I'm sure there's,
yeah.
so there's 9 students in ACC that are
Yeah.
they were like the certificate. I'm assuming, but I don't. So Prince requested this,
so I have to feel
and
this.
he copied me after.
Interesting how it's very
And you would go.
At that point, we used to go to get the grant certificate.
program. But I do want to go on a certificate. I mean, there was a way to kind of actually we're up to the someone knows how to do that. That's what I kind of figured. Okay. So would you be okay with that? So we might. We're just secretaries.
Anyone need more time?
It's been like a lot of
All right, we're gonna bring it back. If group one, I'm gonna put this scenario on the screen. If someone in your group would like to read it out to everybody.
During free time, Janelle heads to an outdoor cafe with another classmate. A person in a scooter drives by their table and quickly grabs Janelle's purse. It contains her wallet, cell phone, and passport. Is this an emergency? Why and why not?
All right. So what did your group think on this question?
We kind of waffled because on the one hand, it is an emergency in terms of, now she's without a form of communication, financial resources, and like her primary form of identification. So we were like, it's not an emergency in the sense of like there's an immediate threat to her physical safety, but it is an emergency in terms of like it just significantly constrains her mobility and her ability to even advocate for herself because she doesn't have the things she needs to do that.
So what did your group discuss in terms of next steps?
Definitely go to the embassy and try to get some support on passport.
If there's one.
If there is one, ideally, there will be one when you go. Reach out to your friends and your country contacts, just to get like financial support, contact as well. I mean,
another phone.
Yeah, like the cell phone you can replace, but the passport honestly is like not easy to replace, and you definitely want to report that because there could be identity theft. So, yeah, definitely a serious situation.
Yeah, so in terms of emergency, of course, it could go either way. It could be an emergency. Let's say your flight was the next day and you were supposed to go back home to the U.S. And so it might not be emergency, but urgent. It's definitely urgent. It's more, you want to resolve it as quickly as possible. Or it could be more serious in terms of most of us, we always depend on our cell phones, for everything. And being without it, not being able to communicate with someone, whether that's even a few days, it could just feel like a more serious situation in that case. And then the wallet, financial, do they have alternative financial means? Is it they can, get, wired money transfer from back home, or was that all their cash that they brought with them on the trip? And so it could go anyway, and like you said, in terms of next steps, getting that new passport, if there is an embassy in that location, so that's a good point. You might be in a city where let's say if you're a U.S. citizen and the U.S. embassy is in a different city, what would you do in that situation? And so for those, one thing you might want to do is potentially file a police report. So if you are with that friend, so in this situation I made it so that you're at least with a classmate or friend, so ideally they have, a cell phone still with them and they can go with you. But you could potentially be by yourself. But filing that police report will give you documentation that you can take for filing a new passport and show to them that my passport was stolen. Another good practice to have is a copy of your passport digitally. So whether that's a printout copy or a digital copy that you have saved in the cloud, like your Google Drive, for example, that you can bring with you. So they do accept, digital copies of your passport, or like a driver's license, a digital copy of that, if you need to provide proof of identity.
So for leaving the country, airlines would take a digital
So
copy?
they would take the U.S. Embassy would use that to get your new passport issued. It would make the process a lot easier to get your rush passport issued.
So, but then you said, for example, the scenario is that you lose your passport and your flight is the next day. So, would the airline accept
It really depends on the airline, and they might not accept it. you could potentially contact the airline, explain to them in the situation. Sometimes in the U.S., I've heard of people losing their driver's license, and they were able to still fly domestically, but it could really vary for international travel. So you might have to delay your departure until you get that passport. And so that's going to be really a case-by-case basis depending on where you're going, what your time period looks like. You can lose it on a, Saturday night, and you have to wait until Monday morning until the embassy is open. And so every embassy, or at least every U.S. embassy, has an after-hours phone number that you can contact. So even if you weren't physically nearby, you could call them. You can, ask what the next steps are, and they would walk you through that process for getting a new, a rush passport. For, wallet, cell phone, you want to cancel your credit cards. You want to make sure that a good practice is not to keep all your money in one location. So if you have, your bags at home, keep a little extra cash. Maybe you only carry your credit card with you, but you keep your debit card, in your room. And so just kind of separating your different ways to access money is always a good practice. And then cell phone, if you have, if you are logged into, I'm logged into, my Gmail and all my accounts, see if you can access those remotely to, lock those services as well. Anything else any of the group 2 or 3 would add?
Just remember, OGA has a copy of your passport too. So this has happened to a student, and the student reached out to us, and we were able to provide the digital copy of it. So it's one of the reasons we make you do all that paperwork, is so that we can help you out. So.
All right, group 2, if someone in your group would like to read the scenario.
Patrick typically takes the subway between his housing accommodations and his study center. On the way back from the evening classes, he notices an entrance up to the subway station is blocked by protesters. He checks his phone and notices the subway is about to leave in 5 minutes, otherwise he will have to wait 45 minutes for the next one.
Yeah, so the questions are, is this a serious situation? Why or why not? And what should Patrick's next steps be? I heard very interesting conversation.
Okay, it's definitely not a serious situation,
Okay.
right?
Why do you think it's not serious?
Well, he's going to be, there's a protest going on. He's going to be delayed. The way he's presented, he's just going to be delayed 45 minutes for the next train. So unless he's an A-type personality, this really should go have a drink. He could just walk to the next subway station, but he really shouldn't get bent out of shape because, it's a 45-minute wait. Unless you're super A-type, then. So.
Or it could be a woman in a place where it might get dark and then it's not safe for a woman to be walking back from the train station. I'm just making up a scenario.
Yeah, of course. I mean, the situation would be,
It could be something.
but then we have to put it into context, where are they, what country, and all those factors, right? So,
Yeah, because we also talked about resources have changed completely. Now we have so much access. Yes, we have Uber, Lyft here in the United States, but other countries have different resources as well. Might not have Uber because it's illegal, but they have their own systems now. So you could use another type of transportation.
Yeah, so alternative transportation means, might not, like you said, might not be Uber, Lyft, or equivalent of that. Anything else?
you should just enjoy the protest, watch it as an outside observer, use it as a cultural event that's happening in his trip, and yeah.
Yeah, I mean, for protests, it really varies. I know when I was in South Korea, at that time, the former president was being impeached, and they had these huge protests that were largely peaceful. I think actually they were probably the most peaceful protests that occurred. And it wasn't for me. I was like, studying international policy, and I was like, oh, this is a historic moment in history. I might want to see it. Other protests might escalate, so you never know what way it could go. Historically, South Korean protests have been very violent. And so initially I never went. I kept away from that situation. I intentionally did not go. And even if I went, I always made sure that I had an alternative route to be. But what we're seeing in the news, like every single day, pretty much every alert that I get is that there's a protest and they turn violent. In like Jerusalem, there's been extensive protests in Israel and Tel Aviv. In Nairobi, there's been violent protests, so you never know which way a protest could escalate. And so usually the best practice, although you might be curious, is to step away. Unless you know you're with someone that can vouch for that situation. In general, protests you never know when it can get serious. So it's better to avoid them if you can. And like you said, it might not be an urgent situation if they're comfortable, if it's a safe location, if they're willing to wait 45 minutes, if there are alternative transportation means, they could seek that as well. And so it's really, of course, like you said, it's going to really depend on that individual, their own personal well-being, that location that they're in. But usually the best, in this situation, I didn't want someone to say, like, let me just walk through the protesters and just get onto the subway.
Yeah.
That ideally wouldn't be your strategy in that situation. So they're all alternatives that you could consider. And again, it's going to really depend on where you are. So scenario number 3, someone wants to read it for the group.
Yeah, a group of students want to go hiking on the mountain over the weekend during their free time. The mountain is several hours away by bus, it's quite high, and it's unlikely to be paved or in good condition. They have already purchased bus tickets and plan to return late at night. They are inviting you to join them as well.
Alright, so the questions are, what are some of your concerns about their plans? And then what questions would you ask? And what would your next steps be? Anyone in that group?
Yeah, so we had a lot of questions. So when are they returning? It just says late in the evening, but we don't know when. Would it be better to stay the night somewhere if they have like accommodation close by? Is there going to be cell connection? Are they like physically in shape for this? We don't know. Do they have hiking gear? We don't know. Yeah, and then so we'd want to get the answers to those questions, I think, before we would say yes to going with this group of students. And then maybe it's better to like schedule a tour or like go with a group that's like a legitimate like travel group. We don't know.
Yeah. So definitely great questions to ask. Like you picked up, we don't know what time of evening they're coming back. Is it like 6 p.m. or is it like midnight that they're coming back? The road conditions, like they might getting there is very like you have to take an hour to get there by bus. Is it safe to take a bus transportation to that destination? And then an alternative could be like, is there a tour group? Is there a guide that's coming with you that's a local? Do locals typically go to that area and hike? And that's usually a good indicator of like, if locals are going there, if lots of people are going, your families are going there, then it could be, relatively safe to go there. But if like only the really avid adventure climber is going to that location, then it might be an indicator that that group might not be prepared. And so definitely talking to people who are from that area to see what is it like there, if there's a tour, is there alternative options that you can go there, or you could just say no, you don't have to go, or asking those questions might make them think about like, hey, did I think about this? Will I have self-coverage? Maybe they need to change their plans as well. And so always good to look out for each other, or if you're in a space where you are with other students, or just any friends that you make while you are there, ask questions. Like if your gut is telling you that this is not right, usually that's true.
Yes.
So if your gut is like, this is not a good idea, I shouldn't do this. I know sometimes you might get like, you just want to do a lot of activities while you are abroad, but always take into account like what is the safety, what are the precautions that they're taking. So you're really hit it spot on.
All right. Say another thing is just like here during the summer, sun goes down at like 9, right? 9:30, and if you're somewhere closer to the equator, it may be dark at 6:30, right? And so I think sometimes that can catch people off guard, and you might end up being in a place where you didn't expect to be at dark. And so just thinking about that minor thing, right? Where are you located in the globe?
Anyone wants to add anything to say?
I just want to agree with you. Like, ask local people, like, the feasibility of something.
Mm-hmm.
I mean, they would know, right? They may say, like, yeah, it's easy, or no.
Like even here, if someone went like, should I go to the Arb at midnight?
Right.
Maybe not, depending on who the person that you ask. But if like, hey, if you go on a Saturday weekday, like a Saturday in the daytime, just walk a trail, they'd be like, okay, that's totally fine if you went by yourself. So like, they know the area, they know what's norm, what's not norm, and they usually can give the best advice. So thank you. That's it for all my content. What questions do you have? I know we kind of asked in between, but I'm definitely happy to answer anything that you thought of.
Will you send us this?
Yeah, so you'll have access to the slide deck. I think Greta will be sending it, and I'll also send that link for the medication, what's legal and illegal.
Do you have a sense right now how long it's taking to get appointments at UHS through the travel clinics? If you don't, that's fine, but.
I'm trying to remember. I know they were booked out a little bit pre-spring break. I don't know what the current wait time is pre-summer.
But that's something just to pay attention to, is that's not a good thing to leave, especially if you're going to need a vaccine that needs a series or something like that. And in some years, they've been very booked up, and so just making sure you're planning ahead.
Yeah, and some vaccination, it needs to be like, you need at least 2 weeks before it's valid, before you can actually enter there.
I had an experience with the health center. So I booked a travel appointment, and then I needed certain tests. So I needed some blood work. So I contacted U of M Medical, and they wrote, I guess, a script that I could go get the blood work. So I had an appointment to get the blood work. That was done. And then I had my travel appointment, and my travel appointment person said to me, "Well, you already got what you needed. Like, you don't need. I'm not gonna do the travel appointment because I'm gonna have to charge you for this. You really don't need a travel appointment because you already fulfilled the requirements." So she said, "I want to just, cancel this appointment for you." So that's sort of how my situation happened.
Because you'd already done the blood work, or because you'd
I
done
did
the
it the same
Australian
day,
paperwork?
and I was, the same day I was doing the work, and she was just saying, you don't need to do it, right? So, yeah.
Yeah, I'd have to know more about the specifics, but it could have been like, since you already met all the needs for that destination, maybe saving you the money of being charged.
Right, I guess in order to do certain things at the University Health Center, either from the travel appointment, they need to have a director for you, or medical can send it to them, right, if you know specifically what you want. So I'm saying that in case people can't get that travel appointment, if you know your requirements, they may still accommodate you to get the shots or the blood work.
Yeah. So I think Michigan Medicine also has a travel clinic. Like, I think it's either.
I think it had closed.
It may have closed, I think.
I think we found out that it's only for employees now.
Yeah.
That recently changed.
Yeah. So that one closed, unfortunately. But you can check the CDC website. Usually that is a good resource to see like what vaccination is required, what's recommended, what are the health risks in that destination, and that can be your initial. And if everything is just recommended, it's up to you if you want to get those vaccinations. But if there's anything required, then you want to make sure you get that taken care of. I think that's it. I think it's your turn.
Thank you so much, Aisha.
All right, so Greta and I are standing between you two and all of you in dinner, and we will make sure that we don't take too long, but the food hasn't arrived quite yet, so we're not holding you from the food yet, but.
The more you pay attention to me, the easier this will be. Okay. I'm going to pass a couple things around. So I have a sign-in sheet for those of you who haven't signed in yet. And then who has already filled out their travel worksheet before they came here? So Adia got you. We're going to do the raffle at the end, so I want to make sure I have everybody down. Okay, Annie, you did yours. Annie and David and Lady who signed through. There, I have one right here. So yes, if anyone needs one, I have extra.
Oh, did you email it?
I did email it to you as well. So if you prefer to do a digital one, you're also welcome to do that. It's okay. Okay, and Sydney, I got yours. Anyone else? So Sydney, David, Lady, Annie.
then I'm also going to pass around, so the next thing that we're going to do to follow with the safety presentation we just had is I have these safety cards for you all. So on the front it has, these are things if you have already filled out your travel worksheet, this will be very easy because it has sort of the same information about emergency contact numbers, the closest embassy and consulate, things like that. So you can copy that here. On the back is a space for sort of your own personal emergency contact information. So we made these cards so that you can stick them in your passport or something like that, like have handy tape with you so that you have this information with you in case of emergency. So we're going to give you time to actually fill these out right now because it's really important that you have this information handy. If you don't have your worksheet with you, you can pull it up on your computer, on your phone. This QR code will take you to the embassy or consulate for where you're going, and we'll have this information so you can use that to find it. So I'll pass these around, and I'm going to ask you all to fill it out right now. We'll just take a couple minutes to do that.
I think if you fold them in half, they're like the size of a credit card.
There
So
you go.
wherever you can put a credit card or a driver's license, you can tuck these. And we'd also recommend you just take a picture of it once you've filled it out too.
And you don't need to fill out the whole worksheet right now if you haven't already done it. If you know, I would absolutely recommend that you do that before you travel. But please focus on doing the card. Okay.
And also add the DPSS number.
It's on
Yes,
there.
it's on the back, and so
Okay.
is the SafeAct number. So.
It's Geo Blue.
Okay, for the sake of time, I'm gonna keep going with the presentation. If you're still finishing up a couple of things, that's okay. Next, we're gonna just talk a little bit about ethical photography. And so this is something that I think has sort of transformed conversations around this over the time, certainly that I've been around the school of social work. And it's important, and I think there's a sort of different viewpoints on it, different ideas about what it means to be a traveler taking pictures, about when that's appropriate, when it's not, how to use those photos or not. And so I certainly don't have all the answers, but I did want to share a resource that has just a few simple sort of tenets to think about. But first I found this just like a little food for thought to share of a sort of flip the script, like an imagination scenario. So imagine for a moment that you are out at the Ann Arbor Farmers Market and another attendee walking by stops near you and starts taking photos of you, picking out fruit, paying the money to the vendor, chatting, and you start to feel uncomfortable. They're kind of in your face. They don't ask for your consent. They don't explain what they're doing. They're just there taking photos of you going about your life. You'd likely feel uncomfortable. It might even cause you to want to raise your concerns to them or to an authority. You might feel like your privacy is invaded. And that same feeling of discomfort might be the experience of people when you are the traveler and those who you're visiting are going about their daily life might feel when you're taking photographs, right? So I think just that sort of like, what would this feel like if it was my home? I think for me, it has been easy to forget when I'm somewhere brand new and everything seems different, that for the people there, that is their every day. So being able to take that other perspective, I think is a really just core thing to keep in mind when we're talking about ethical photography. And so the next couple of slides, these sort of 4 principles come from a resource called Radiate, which is from, it's a Norwegian student and professor association that this was a project that they did a couple of years back. So the first sort of principle they say about ethical photography when you're a traveler is promoting dignity. So thinking about what are the pictures that you're taking? Are they of sick people? Are they of, children who might be dirty or not in their nicest clothes? Sort of like what does the story of the people in the photographs say to people who might be seeing them, especially if you're going to be posting them to social media, which makes it, really pulls them out of context. So really requires an extra sort of eye for what it means to promote dignity through photography. So some sort of, big suggestions that they have are, thinking about the words that you use if you do post them on social media, that you're not contributing to a stereotype, right? So saying like, oh, these poor people, or sort of like general statements that might reinforce stereotypes of the place that you're visiting. And keeping in mind that people are not tourist attractions, right? And again, this can be, it seems really obvious when we are thinking about it, but in the moment, really being able to step back and thinking about the purpose and the story being told through your photography. So the second principle is gain informed consent. And so I think for me has often been like, ooh, I can't just walk up to a stranger and say, can I take your picture? And yet it was easy for me to just walk up to a stranger and take their picture, right? And so really thinking about this, if you feel uncomfortable asking for consent, then maybe you should be uncomfortable taking the picture. And again, this applies to people, right? This is not about landscapes or sort of like far away photos, but more pictures of like individuals or small groups. Also avoiding taking pictures of people in vulnerable positions. So especially in hospitals and things like that, where people might not be at their best or in particularly painful or difficult situations. Again, thinking about sort of their perspective and being photographed. And then question your intentions. So what is the purpose of your travel? This is a lot about posting, right? But what story are you telling about your travel, about who you are? If you are making yourself sort of the center of a photograph or sort of a hero in the photograph, thinking through ways that might be problematic. I don't know if any of you have seen, there's a sort of like a social media account that's Save Your Barbie, which is like Barbie dolls in, like in Africa feeding the children. And it's like it is very satiric, right? But sort of this look at how this sort of savior mentality in travel can so often come through in photographs. And again, really questioning yourself about where that's present in your photography. And then the fourth one is using your photography to bring down stereotypes, right? So the first three are sort of like, be careful not to do this, but really thinking about being able to tell a news story, being able to promote, things that you're learning about the place that you're visiting, the people that you're listening, in a new way or in a new light or in a connective way, right? Telling about your collaborations with the people that you're working with for your project or in your field placement, taking yourself out of the center and being able to bring new information to the people that you show or share these photographs with. So that's an opportunity that you have, and you may or may not choose to take, but the opportunity is nonetheless there. And then really quickly, I won't read through all of these, but this resource also has sort of a checklist before you post on social media, but really applies to, I think, before you take the photo as well. And so really sort of the application of these 4 principles, thinking about consent, thinking about if you're going to take a picture of, a group of people, are you going to be able to talk about them later? Are they people that you know the names of or know what they're doing? Or there's some sort of purpose of why you want this memory? Or is it just sort of like a general, oh, this is what it was like, but it might come across as more of a stereotype? And then I think this really big question, what would I have appreciated to be portrayed in the same manner? So again, kind of flipping the script there. Are there any questions that come up about ethical photography? Again, I'm not an expert, but I'm happy to have a brainstorm if that feels helpful. There's lots of resources out there, so I'd encourage you to look into this one or others when you're thinking through this. With this in mind, we're not trying to discourage you from taking pictures because we have traditionally had a Global Lens exhibit where we ask our GAS students, our JS students, our MI students, our other students that have traveled to submit their photos for an exhibition each year. Usually it's traditionally been in the fall, and with COVID and everything, we haven't had it for a couple of years, but we would love to start it back again. And so if you enjoy photography, if you enjoy taking pictures while you travel, just to keep in mind that to have some in mind, or, if there's a situation where you think, oh, this would be, something that I would love to share. And we've had a lot of sort of like landscapes or events or things like that that have been really just incredible pictures, or some hanging up in the OGA suite. And so we know that this is a way that students have often liked to express something that's come out of their travels, express their experience, and we really want to encourage that as well. So just kind of taking these two pieces together. This is an incredible form of art, and we need to do it responsibly. So just be aware that that is hopefully coming next fall. Okay. Really quickly, I know many of you, we've already kind of gone over these, so this is just 2 more resources for thinking about how identity and travel abroad intersect. And so there's 2 resources that I'm going to just touch on really quickly. So Global Michigan, so this is for the university, has identities abroad resources. And so this is just for if you have identities in any of these categories, kind of gives you context, things to consider, questions to ask yourself, how to get prepared for travel. And also, the OGA, so the School of Social Work, has our own as well. These 2 resources cover sort of different categories. Some of them certainly overlap, but sort of the same idea, questions to consider, resources, tips, and things like that. So you are welcome. Again, I will be sending out these slides with Aisha's slides as well, so you'll have access to these resources. But those, I think, can be really helpful to sort of think through and reflect on before you travel, while you're traveling, or when you come back, that some of these come up.
We have a few slides to close this out. I think one of the things that Aisha touched on this and just wanted to share with you. I was part of a large group including folks from our psychological center and actually a couple of MSW interns that put together a site on resilient traveling and kind of thinking what that looks like. So similar to what I had mentioned before about we don't want to think about insurance and health and safety stuff just as reactionary, right? Like what happens if I get into a problem, but also what can I do proactively? What do I already know about myself? Many of you have traveled before, and so you may have been in situations that you can think about where if you'd thought about things a little bit ahead of time, you might have been a little bit better prepared to handle them. And also knowing that we'll never fully be prepared, right? We will have to react to things. But we put together this resilient traveling website, and it has a bunch of different resources here. And so there are a couple of different topics that after doing some work with students on campus of some major issues that students experienced. We put together some videos about those, and so we'll watch one of those quickly. But then from the psychological clinic that has worked with a lot of students that have been abroad, they also came up with some different skills that can be useful if you find yourself in a situation where you might be struggling or you need some additional help while you're abroad. And each of these has then a short video that leads you through how to use this skill. And so these are just really short, typically a minute and a half or so videos around some skills. And so this is something that you can kind of look and view. It's something we would think about students using potentially before they go abroad, while they're abroad. But there's also some resources and things like a self-assessment. Sometimes when we go abroad, I think we hear a lot about culture shock, right? It might be something that's different and it's challenging, but sometimes we have students that experience reverse culture shock, right? Where being there in the experience, they are kind of prepared or excited to handle it, and when they come back, they have heavy emotions, or they find themselves mourning the loss of relationships or other things that were part of that experience. And so there's also resources on here such as CAPS. There's a self-assessment that folks can do. And so there's some different resources on this website. And so it's something that it'll be accessible to you in the slides. And even I believe on here, there's a build a roadmap, like what is the challenge you have, what's the plan, and what's the skills. So sometimes just even thinking through something that feels like a big problem, if you just kind of think through what are your options, can be helpful. So let's see, do we have time to watch the video? Yes, we'll. Yeah. Okay, great. So we will watch Jaren's video.
My name is Jaren, and I'm a sophomore at the University of Michigan, studying anthropology. In the summer of 2010, I took a study abroad trip to rural Peru. The trip was a huge turning point for me. It helped shape me both as a student and as an individual. My life before the trip was based on relationships. I was on the school basketball team, I would spend my time at home hanging out with my brothers, and every night we would have dinner as a family around the table. Traveling for me wasn't about uploading as many pictures to Facebook as I could, but rather I really wanted to become fully immersed and assimilated into the culture, to be a part of their community. At first, the entire process was a little bittersweet. I was like a kid in the candy store. Everything seemed mesmerizing. The best part of it was that everyone seemed so happy. Despite not having so many of the things that we had back in the States, it seemed like they wouldn't trade their lives for anything else in the world. It was the strong sense of community that I was so drawn towards. It was beautiful. And although my Spanish was pretty good, there was still a very clear language barrier between me and the townspeople. I felt so isolated because of my identity, not only as an American, but as a black man. To top it off, the only other American who was there with me, the person I was traveling with, well, we didn't really see eye to eye. It wasn't long before I started to miss those family dinners around the table. I would try to laugh it off and have a good time, but one fact rang true. I felt like I was the loneliest and most isolated I'd ever been in my life. To be honest, I cried every night for about 8 days straight. Then there was one day I was lying alone in my hut, staring up the ceiling and just kind of feeling sorry for myself, when I saw this giant shadow appear in my doorway. I looked around and I saw this goofy little kid, missing both his front teeth, just staring and grinning at me. He asked me, "Hey, come play baseball with us." And to be honest, I wanted nothing more than to just lie there in my hut and continue to feel sorry for myself. But I couldn't say no to this kid. So I got up, went outside, and decided to play baseball with these kids. And believe it or not, it was some of the most fun I've had in my entire life. It felt like I was back home playing baseball with my brothers again. I had to accept that while I might never fully assimilate into this culture, and that Peru may never quite feel like home, I could still engage in some pretty amazing and enriching relationships. I could connect with the people around me. And it turns out, they were just as interested in getting to know me as I was with them. It was all about making a choice. I could make the choice to stay alone in my hut, to sit alone and stare up at the ceiling and feel isolated, or I could embrace this amazing culture that I was being immersed in. The decision I made to join those village kids in a game of baseball was a huge turning point for me. It made me believe that the people of Peru really did care about me. And they did accept me as I was, a 6'4", 250-pound black man. From then on, there were still some lonely moments, but I felt so much more connected. And on my last day, sitting around a table with my new Peruvian family, it almost felt like I was back home.
All right. So did any of that resonate with you? Are there things that you experienced that have been similar to that, whether it was somewhere abroad or whether it was going into a new place? So I put a few questions up there, things that surprised you. Have you had a similar experience, and what aspects of your identity might impact your time abroad? Yeah.
I actually feel that way in Michigan because none of my family or friends that I had established before I moved here, I didn't know anyone when I came here, so I feel that way all the time, and I've come up with ways to connect with, like, not only new folks but also my family in meaningful ways, even though I can't be there. So I'm from Wisconsin, I'm not that far away, but I can't just, pop over and say hi, so
it sounds like you found some strategies over time, right, that worked in balancing.
It definitely took some time to figure out what worked. But.
Yeah, and sounds like some connecting with folks that you can, and also finding new ways to connect here.
Yeah, I was in Costa Rica living with a host family and studying Spanish, and I kind of felt that, coming right from New York City to Costa Rica, so it was a bit of a shock, and I just kind of let go more. I think it's important to kind of like unlearn and let go, and when I did that, it just sort of became like just new experiences. So
I imagine maybe some of the things you went to as things that were enjoyable, or things that if you had stress maybe weren't available to you in the same way, right, between New York City and Costa Rica. And I think that's one of the things often strategies you have that work well may be very different depending on where you are, right? And so I think that's, you know, one of the things we just, again, want you to kind of think through. You know, there are some of the things, strategies, so some of the ones that I've listed here are ones that if you start overutilizing, you might need to think about, do I need some help or do I need to reach out or find some other strategies? So things like, you know, staying in bed for 12, 14 hours a day or isolating, heavy alcohol use, or maybe eating excessively or not at all, avoiding being with other friends. So there's a variety of these. Actually, a lot of these things, if they're done in moderation, may be helpful things for you, right? So like exercising may be a way to help you unstress, but if you find yourself over-exercising, right, maybe that's a problem, or getting good rest is a good thing, but if you find yourself sleeping all day over the weekend, kind of thinking about all of these things. So again, just thinking about, you may know how to manage yourself here, but the context of where you go may be very different. And so thinking about, like, what are my go-to strategies, and if I can't utilize those for various reasons, then what would I, you know, what can I do? What are some other strategies that I can have? The Resilient Traveling website has some resources as well. There's like a UCLA, I think, meditation site, some free yoga videos. So there's different things that you can try. I'm a person that likes to run, but I can't always run everywhere I go because maybe there isn't sidewalks, or maybe it's not safe for me as a woman, or for other reasons. So thinking about things that may be helpful for you in one environment that may not be in others. So I think, you know, some of the other things to just think through, I don't think any of this is novel, but just thinking about some other ways that you might connect with people regularly, you know, building support networks. I think you'll notice that on here, both overutilizing technology, social media, you know, Facebook, you know, if you're using FaceTime, those things, that can be a strategy where you're kind of checking out of where you are, but it's also a strategy that can be helpful, right? So I think, Sydney, you shared like connecting back with folks at home. So just kind of monitoring. If you're only kind of living somewhere else, maybe that's not great, but if you're feeling lonely and you need to connect with someone that's your peer support, you know, maybe that is helpful. So there's no kind of right answer to this, but just want to make sure that we're kind of thinking through and being a bit proactive about what you can do and what you can access as you inevitably will encounter some challenges or discomfort. So then I think we've just got a couple reminders here, and then we'll go to dinner. So one of them is all of you as folks that have received funding from the Office of Global Activities or that are in our Peace Corps program will create a poster when you come back. And we haven't been able to do this like the photo exhibit since before COVID, but we're really looking forward to it. So we'll have posters put down here one day in the fall, and it's both an opportunity for incoming students or first-year students to learn from you about what you did, for you to showcase and share with folks. We typically get ice cream from Washtenaw Dairy, so we wanted to put that on your radar, and you'll get more information about it, but it kind of connects with, sometimes if students take no photos while they're abroad, they're kind of like, what do I put on here? So kind of thinking about that. Nothing you need to do now. But I don't know what happened to the images, but maybe I just need to, I don't know. So Sadia is going to be emailing you. We have a display case in OGA where we put a map up typically and put little dots, like pins for each of you where you are and where you're going. So Sadia will be reaching out to you about having you on the display case outside of OGA, but we also put a map on the School of Social Work website. So you don't have to participate, but if you'd like to, typically that's something that, that a lot of students participate in. And then finally, we have the winner for, it doesn't have to be a Lonely Planet guidebook, but for the people that did the worksheet in advance, you can get, the winner is Lady. So, so you'll connect with Greta, and if you find some type of travel book that you would like, we'll happily ship that off to your house. And so, bring that before you go abroad. But are there any other questions before we wrap up? So we'll have their t-shirts, so if you all ordered and put in a t-shirt size, we have those upstairs, and then the food is up in the ECC. So it's just Chella's Taco Bar, so hopefully there's something that can accommodate all types of any dietary restrictions. There's no real kind of presentation or anything else upstairs, so it's just grab food, find a table, talk to people. You all are the entertainment, so